Hi friends, I am Dr. Pratap Singh Rathore. I have done MD in Pharmacy Medicine and today we'll continue with medical legal aspects of wounds. In that we'll discuss about cause of death from wounds. So as we have already done from different way in different videos, there are different types of wounds caused by different types of weapons and scenarios. So in all those wounds, there may be different types of cause of death. So cause of death can be divided into immediate cause and remote cause. So immediate cause in that there is first is hemorrhage. So hemorrhage can be any type of hemorrhage. It may be external hemorrhage because of injuries like stab injuries or firearm injuries or accidents where major blood vessels has been cut and there is hemorrhage, or internal hemorrhage like blunt trauma on the abdomen or some abdomen trauma on the any major organs and there is internal bleeding in the system. Any reason may be there. When there is more than one third of blood is lost, there is a chance that person may die because of hemorrhage. Next type of immediate cause is reflex vagal inhibition. This is a condition scenario where because of since the vagus nerve innervates most of the visceral organs, any stimulus of vagus nerve because of some injuries may cause reflex stoppage of heart. Next is mechanical injury to vital organs. So vital organs like brain, heart, or lungs, if there is any injury which can directly cause the damage to these organs like crushing of a brain or crushing of the heart, then person may die immediately. Next immediate cause is the shock. The shock is a circulatory disturbance characterized by hypoperfusion of cells and tissues due to reduction in the volume of blood, cardiac output, or restitution of blood. So mainly in shock, there is a hypoperfusion of cells and tissue. So each types of cells, like any cells like types brain cells or muscle cells or skin cells, any cells where there is decrease in hypoperfusion of these cells because there is decreased volume of blood or cardiac heart is not functioning properly, it's not providing heart properly, not providing blood properly, or there is a difficulty in restriction of blood may lead to shock. So it may be primary shock which results from sudden reduction of venous return to heart, or secondary shock where there is circulatory stimulus which develops gradually over a period of time. So there are different types of shocks. It may be divided based on the stressful circumstances. Like one is hemorrhagic shock, as we discussed from any type of hemorrhage. Because of lot of hemorrhage, the heart is there is decrease in cardiac output. Cardiac is not able to pump enough blood, which is not present in the body. So there is hyperperfusion of tissues and leading to shock. Traumatic or wound shock. So there are multiple injuries may be formed on the body, like in road traffic accidents. So if when multiple injuries are caused, multiple hemorrhages may be there and person may die because of blood shock. Then burns shock. So there is burns when the person's body is burns, like in case of fire injuries, fire accidents, or in case of suicide. Sometimes the person may try to kill himself by using burns. If there is more than 25% of body is burnt, there is a third degree burns are present, there is a loss of plasma from the body which leads to person going into shock and death. Then in case of surgical shock, when the person may during surgery there may be loss of fluids and more blood leading to death. Cardiogenic shock. Cardiogenic shock may be because the cardiac is not functioning properly because of like tamponade, where cardiac tamponade where the cardiac is not filling properly, or maybe because of medical infarction, the function of the heart is decreased, uh, cardiac function is decreased, or blood is not getting inside the heart properly, like in case of hemorrhage, then there may be cardiogenic shock. Then septic shock, is mainly because of infections where there is a gram negative bacteria infections where there is vasoconstriction and there is no enough blood reaching the heart. The endotoxic shock, again because of some enzymes related from the resistance of infections, the person may go for shock. Now coming to pathogenesis of shock, mainly there is a first you should understand there is a decreased blood volume. It may be because of any reasons the blood volume is decreased, which leads to decreased venous return. So when the blood volume is decreased, the blood reaching the heart decreases. This leads to low cardiac output. So even though cardiac may be functioning properly, so in case the cardiac is functioning properly, their cardiac output is decreased. So to compensate that, there are different mechanisms present in the body, like neurohormonal compensation, increased heart rate, increased contractility of the body, then vasoconstrictions. So these are different compensation to compensate the decrease in blood volume. So when the failure of this compensation persists, and because there is a decrease in the blood volume, or the injury which has caused in decreased blood volume continues, there becomes hypotension. This hypotension leads to microcirculatory changes, poor perfusion of vital organs. So, since blood reaching the different organs decreases, this may lead to decreased oxygen delivery to different tissues, or major organs starts dysfunctioning. There may be renal failure, there may be cerebral hypoxia, or acute respiratory distress syndromes may occur. This all leads to inability to utilize nutrients and remove metabolic waste. This then leads to cellular injury, release of proteolytic enzymes and toxic produced in the body, then downregulation of oxygen metabolism, failure of ATP production, acidosis. This all again leads to major function. The person may die mainly because of multi-organ dysfunction, and person die because of all the organs stop working. This is the basic of any type of shock. Coming to remote cause of death, first and foremost is the infection. It may be primary infection caused by the wound itself, which has caused the injury. Like there is a stab wound, or there is an incised wound which is not cleaned properly. That injury wound can lead to infection. That is the primary infection. Then there may be secondary infection. Because of primary injuries, the person may be debilitated enough that there may be secondary infection may occur during his stay in the hospital. Hospital stay may lead to secondary infection, which also lead to death by septic shock or other reasons. Then gangrene or necrosis. This is a modified form of case where there is a stoppage of blood to the organs. When there is a decrease in blood supply to the organs, there is a formation of necrosis. This leads to modified necrosis, leads to gangrene formation, where the whole tissue gets died off, becomes blackened, and get amputated. Then next form of remote causes is Grush syndrome, mainly seen in lower limbs, where a part of compartment like a gluteal compartmental syndrome, where the part of limb is crushed and that part gets infected, and this lead to Grush syndrome. Then neglect of injured person, the person who is injured, and if he is neglected, like in old villages, sometimes the old people who have minor injuries are neglected. Those minor injuries may become cellulitis or lead to septic shock, and person may die because of that. Then case of surgical operations, during surgical operations, again due to loss of blood vessels or due to because of loss of some infections, the person may lead to die after surgical operations. Then natural diseases, person is already has some chronic infections like tuberculosis, or he maybe have some cancer, or he may be suffering from HIV. Then the person's this, and there is an infliction of some injuries, and this may predispose this and lead to death. Then superimmunization disease from traumatic lesions. So certain lesions may increase the chances of infection, increase the predispose the disease already present. Like person may suffering some diseases related to blood vessels, and injury may cause the person to lose more blood, and person may die because of that. Then thrombosis and embolism formations. So thrombosis, mainly there is a clot in the blood vessels. So in the blood vessels, there is forms of thrombus may be formed. So this may be thrombus may be because of some clot, or maybe any other foreign object which are inserted in the blood may stop the blood supply because of thrombus. Whereas embolus is a form of foreign object or a thrombus which moves from one place to another place. This, when lodges into the smaller capillaries leads to person leading to some causes. Ladies, this thrombus may obstruct emboli, become emboli, and may obstruct in certain minor vessels. Like it may, in case of if it lodges in the heart, it may cause myocardial infarctions. So there may be different types of emboli. There may be fat embolism, which commonly is seen in case of fracture of femur. So in fracture of femur, there is chances that the emboli, the bone marrow from the femur may get dislodged and obstruct the blood vessels. Or air embolisms, mainly because in cases of like injury to the abdomen, there may be there, or faulty IV insertion may also lead to air embolism, which may lead to death. Then there is adult respiratory distress syndrome. This mainly caused because of some injuries like on the lungs, where the lungs get stiff and the breathing capacity of the lung, the expanding capacity of lung is decreased, leading to the person going to distress and asphyxia. Disseminated intravascular coagulation. This is the form of coagulation throughout the body. So throughout the body, because of release of some certain types of enzymes during infection, some injuries, these enzymes, and catecholamines causes coagulation throughout the body, leading to death. Then suprarenal hemorrhages in the suprarenal regions may also cause death, remote cause of death. Now, certain medical legal questions which has to be answered in case of any type of injury. So we have to know whether the any injury is antemortem or postmortem injury, since many times the person may be killed by stab injury and thrown in the road to cause road traffic injuries. Main difference is antemortem injuries looks bright in color. They have bleeding capacities. Postmortem injuries are now don't bleed profusely since they already the heart has stopped. So postmortem injuries we can differentiate by that, and by presence of enzyme activity, mainly presence in antemortem, but it's absent in the postmortem injuries. Then time of infliction of injuries, as we discussed in different injuries like abrasions, contusions, it can be differentiated a little bit, but it is very difficult with multiple injuries are occurred simultaneously. Then we have to answer whether fatally internal injury may present without any external injury. So there may be multiple injury, but the fatal injury may be different. So which fatal injury was there? It has to be differentiated. So there may be presence of internal hemorrhage. There may be multiple injuries on the body, but there may be one internal hemorrhage in the liver there, which may be cause the death. Then you have to know which injury has caused the death. So the injury. So this question arises when the person may be injured by different regions, like the person may be hit on the head and he may become unconscious and may fall on the road, and he may be alive at the time of head injury, but at the road he may come road traffic because of road types he may have died. So we have to know whether the person died because of any head injury or the person died because of road traffic accident. This can again be differentiated based on the antemortem and postmortem injuries. Then how long the dead victim survived. This also has arises when if the what type of which injury has led to death, whether the victim has survived or he had been given immediate medical care. This arises in cases if the person was in again mainly in a road traffic accident, when the person had been hit, and if the immediate care was taken, whether the question arises whether it was he was able to survive or not. Can the wounds be altered from their original appearance? So sometimes many injuries may be altered, like for example, the person may be stabbed by some circular weapon and it may stimulate like a firearm injuries. That has to be again examined based on the gun residues. Whether the injuries can be produced by more than one type of weapon. So that also again clear for examination of weapon injury can differentiate whether it was the injury is because of sharp weapon or blunt weapon. Then you have to know whether the relations between the trauma and the natural disease. So again, this is important because of culpable homicide. So we have to know the person intention of the intention of injuries. If the person has some natural diseases and the injury has led exaggeration of that natural disease and the person had died, or whether the person died because of injury itself, has to be differentiated. In both cases, we have to know whether what was the intention of the person who tried to kill him. This is again it becomes important in case of differentiating whether the person culpable homicide is applicable in that case or homicide is applicable in that case. These are my references. Thank you.